Hello, my name is Dr. Harold Koenig, and I'm going to be talking to you about moral injury. So I'm a professor of psychiatry and behavioral sciences at Duke University and have been working on this area of moral injury for a number of years now. So I'm going to go ahead and share my screen and then begin the presentation. Okay, so what is moral injury? According to Brett Litz, who is a psychologist at the VA in Boston, he defines moral injury as involving an act of transgression that creates dissonance and conflict because it violates assumptions and beliefs about right and wrong and personal goodness. So in other words, moral injury involves inner conflict over a transgression of moral values. Now, moral injury is a relatively new syndrome, yet it is quite old. It often occurs in the setting of trauma, such as post-traumatic stress disorder, but moral injury is distinct and separate from PTSD, as I will show you a little later in this presentation. Now, moral injury often occurs in members of the military, and in fact, that is where it began. The concept really became more and more known because of those in the military who experienced various traumas and then did things or observed things that were against their moral values and ethical values, and they were troubled by that. So then research began studying how common moral injury was among veterans and among active duty military, and it was found to be quite common. And I will describe that in a moment as well. But you know, moral injury isn't just limited to members of the military who have been in combat operations. Rather, it's also been found among first responders, such as police, firemen, or even emergency medical personnel. In fact, moral injury has been found among civilians who have experienced severe traumas of various types. Also, during this COVID-19 pandemic, healthcare professionals have experienced moral injury as they have struggled with caring for patients, not being able to provide the resources that many patients needed, and also because they have been put in a situation, perhaps by the hospital, where they couldn't provide the type of care that they have been trained to provide. So moral injury occurs in many different settings where people feel that they have transgressed their moral values in some way or have observed others transgress moral values. Now, there are various dimensions of moral injury that involve psychological, spiritual, and religious dimensions. So let's take a look at some of those. Well, let's first of all look at the history of moral injury, which, as I said earlier, has been around for a long time. In fact, the Greek root for moral injury is miasma, and miasma is an ancient Greek concept of moral defilement or pollution, often resulting from unjust killing. but applicable to any transgression of moral values. And it applies to the perpetrator, the victim, and even the observer of such perpetrations. Now, there is a, in 424 BC, there was a warrior that was part of a ancient myth that was involved in killing and doing various things that he was ashamed or felt guilty over. So here's a quote from that book. What can I do? Where can I hide from all of this and not be found? What wings would take me high enough? How deep a hole would I have to dig? My shame for the evil I have done consumes me. I am soaked in blood guilt, polluted, contagious. I am a pollutant, an offense to the gods above. So this is what moral injury is really about. It's about this deep sense of shame and guilt over having transgressed one's moral values. Now, there are various terms for moral injury that have been used. One is called inner conflict. Inner conflict describes the feelings that people with moral injury are going through. There is also a term called spiritual injury. This is a term that many psychologists have used to separate out the psychological from the spiritual symptoms of moral injury. And then there is soul injury. So these are various terms that have been used. Our research group have not separated out the psychological from the spiritual symptoms. Rather, we have included the psychological, the spiritual, and the religious symptoms all in this concept of moral injury. So here is a visual description of what occurs with moral injury. So there are various events that occur, various events such as killing, violence, committing violence to others, witnessing violence, not being able to protect innocent bystanders, being placed in a morally compromising position, witnessing others, especially leaders, violate moral codes. And then in the rage of battle, this applies primarily to members of the military, there is a dehumanizing of the enemy. The enemy might be in some way, their hands or fingers cut off or whatever, the dehumanizing of the actual bodies of the enemy after they're dead. There is plundering of the enemy that could involve taking things from the enemy, whether they're dead or alive. And then acts such as rape, torture, and this can apply to either the victim of the rape or torture or the perpetrator who actually did the evil act. So those are the events. And these events transgress the person's moral code. Okay, they go against it. They violate their moral code. And then comes moral injury. Here are some of the religious aspects of moral injury and some of the psychological and spiritual aspects. So the religious aspects of moral injury include religious struggles, feeling that, God is punishing them, or God doesn't love them, or doesn't have any power to make a difference, or feeling that their faith community has deserted them, things of that nature. Religious and spiritual struggles over having transgressed the moral code. And then there are the psychological and spiritual aspects. Psychological aspects include guilt, shame, moral concerns, feeling betrayed, loss of trust, difficulty forgiving. And here are some of the spiritual aspects: difficulty forgiving, loss of meaning and purpose in life, and then self-condemnation. So that's what moral injury is in its three dimensions of religious, psychological, and spiritual symptoms. And then what happens is that these symptoms have clinical consequences. In other words, they can worsen PTSD symptoms. They can give rise to depression, anxiety. People may try to numb themselves so they don't have these feelings through drugs or alcohol. These feelings can cause relationship problems. They can cause people to develop chronic pain and cause physical disability. So all of these clinical outcomes can be influenced by level of moral injury that the person is experiencing. Okay. Now, just for clarification, we call it moral injury. We call it, psychologists and mental health professionals call it moral injury. But, moral injury has been around for a really long time. In fact, probably since the Garden of Eden. And basically what moral injury is it's sin. The term sin has been used in the past to describe moral injury, the transgression of moral values. So moral injury has been around for a long time, but only in the last 10 to 15 years has it received clinical attention. And as it has received clinical attention, we've discovered that it has a lot of bad consequences, as I've described here in this slide, the clinical outcomes. Okay, now let's look at how common is moral injury. And I'm going to focus here on moral injury in the military, okay? So what we found in a multi-site study of US veterans, 373 veterans, that when we administered our moral injury scale and looked at the severity of the symptoms, we found that nearly 60% of these veterans had, actually 90% of these veterans were experiencing at least one of the 10 symptoms of moral injury. And when we looked more closely, we found that 60% were experiencing 5 or more such symptoms at a very severe level. In other words, a 9 or 10 on a 1 to 10 severity scale. So you can see here that many US veterans, after serving in war, are coming home with symptoms of moral injury. Now, we also studied over 100 active duty US military, and we found that 80% had at least one symptom of moral injury, and more than half had 4 symptoms or more. So at least within the military, both veterans and active duty, moral injury is extremely common, and it is often ignored and not addressed. And yet it can interfere with the treatment of PTSD and other mental health conditions unless it is addressed. And so far, there hadn't been much attention paid to moral injury because all of the focus was on the clinical syndromes such as PTSD, depression, and these other mental health conditions, whereas it was the moral injury that was blocking the treatment response to these interventions, whether it be medication or psychotherapy. Okay, so here, if you want to know more about these studies documenting the high prevalence of moral injury in veterans and active duty military, here are a couple of articles where that research has been published. Okay, so now, is moral injury important in other settings besides the military? I had said earlier, yes. And the only issue is that there has not been as much research among these other groups. So first responders are a high-risk group because they're seeing all of this trauma, and sometimes they're not able to do anything about it, and they feel bad about it. They feel, that they wish they could have done something, and they feel guilt and shame for not having done things, even though, they really couldn't have prevented these things from happening. But it's just the sense that when you see a terrible thing going on, whether it's a victim of burglary or assault, or even a car accident, or victims of being in fires, you make every effort to try to help, but sometimes things prevent you from doing so. And sometimes your own fear may prevent you from acting in a way that would be self-sacrificing. And so people experience symptoms of moral injury in these conditions as well. Also, after disasters, either natural disasters or man-made disasters, such as terrorist attacks, people feel bad about not having helped other people who are experiencing it, or for some reason feel that they have brought this on in some way. Also, things like rape can be frequently accompanied by symptoms of moral injury. Healthcare settings, as I said earlier, if the healthcare professional, like a nurse, can't provide the best of care, maybe they're just following orders, and they're put in a position by physicians that make them feel that they're not providing the best of care, or simply nurses and doctors get tired, get exhausted from the work that they're doing, and therefore cut corners and don't provide the best of care. And they feel bad about this. They feel guilty, shameful about it. They condemn themselves. Then there is just everyday life, with any kind of a loss, change, or family conflict that results in bad outcomes. Moral injury can easily occur, and people can experience these deep symptoms of shame and guilt, self-condemnation. They have trouble forgiving themselves, forgiving others. They have trouble with meaning and purpose in life. Their ability to trust others are affected. All of these things, all of the consequences of sin are the result of moral injury. It can also occur in church settings where the clergy might be involved in some kind of abuse, or might be involved in adultery in some way, and church leaders experience symptoms of moral injury, or simply burnout. They just simply cannot meet the needs of a congregation, and they feel bad about that. They feel, like they should be able to do that. And then children with adverse childhood experiences. So many children who have been abused by their family or by others feel like they may have contributed to this abuse and feel bad about it, feel shameful that they were the victims or couldn't do anything about the abuse that they experienced. And they may have anger, a lot of anger over it. And all of this relates to moral injury, we think. So how do you identify moral injury? So there are two types of measures that have been used. One involves events, a measure that quantifies morally injurious events and symptoms that result from those events. So these are the two most common scales are the moral injury event scale, the MICE, and the moral injury questionnaire military version, MIQ-Q. So these are primarily used in the military to assess moral injury. And then there are the symptom-only scales. And the reason why these scales here are recommended is because if you're assessing changes in moral injury, the scales that include events, the events can't change. They've already occurred. So when you're using these types of events and symptom scales, these are less sensitive to the symptoms that people are experiencing. Therefore, we and others have developed symptom-only scales where you can actually assess the level of moral injury symptoms and then track those symptoms over time in response to interventions designed to treat the moral injury. So we developed one of the first scales out there, and this was the moral injury symptom scale, military version. And then this was actually a 45-item scale. And then we developed a short form of that scale that consists of only 10 items. And I'll show that to you. That was the MIS-M short form. And then some colleagues of ours, particularly Joseph Currier at the University of Southern Alabama, developed the expressions of moral injury scale. This was a 17-item measure that assessed symptoms only, and also a short form of that, only 4 items assessing symptoms. The only issue with these other symptom, whether it be events and symptom scales or the symptom-only scales, is that they only measure transgressions of moral values, and they don't measure any spiritual or religious aspects of moral injury. And we thought that, given that religions have dealt with sin for thousands of years, some of these symptoms give rise, some of the moral injury gives rise to spiritual and religious symptoms. So our scales are the only scales that include symptoms like religious or spiritual struggle, or symptoms like a loss of faith, a loss of religious faith. So we feel that those religious and spiritual symptoms, including forgiveness and loss of meaning and purpose in life, that those are very important symptoms that result from moral transgressions. Okay, now, if you're interested in a comprehensive review of the different scales and their usefulness, there's an article that we wrote in Frontiers in Psychiatry that you can go to this website and download the article for free, and then study it. It's got a lot of good information. Okay, so here are some examples of the scales that we've developed to measure moral injury. These are symptom-only scales. They range in score from 1 to 10. And so here are the kinds of questions. I feel betrayed by leaders who I once trusted. Now, this is the military version. I feel guilt over failing to save the life of someone in war. I feel ashamed about what I did or did not do during this time. And then most people are trustworthy. This is actually scored in reverse. So if someone indicates a 10 score, that actually is scored a 1. I have forgiven myself for what happened to me or others in combat. This is also scored in reverse. So if they score a 10 here, it's actually, they're given a score of 1. All in all, I am inclined to feel that I am a failure. So now, if they strongly agree, then they get a 10 on that. I wondered what I did for God to punish me. If they strongly agree, they get a 10 also. I wondered, and then compared to when you first went into the military, has your religious faith since then weakened a lot, weakened a little, strengthened a little, or strengthened a lot? So if they score a 10 on this scale, they actually receive a 1. And if they score a 1, they get a 10. So basically, after reverse scoring items 5, 6, 7, 9, and 10, then you add up all of the scores, and then you will have a score range from 10 to 100. And typically, scores over about 35 indicate that there is some significant moral injury present. That's a total score of about 35. Okay, and this scale has been published in military medicine. So this is the short form of the moral injury symptom scale. Now, here is the civilian version. So this can be used to assess moral injury in civilians, in people undergoing trauma, rape, robbery, automobile accidents, all sorts of different trauma. You can assess moral injury in that setting. This has not been published, but it actually is published in a book that we wrote called Religion and Recovery from PTSD, which was published by Jessica Kingsley Publishers in 2019. That's where this scale can be found. So again, it's just been, the military version scale has been slightly modified. You can see I feel betrayed by those who I once trusted. I feel guilt over failing to save someone from being seriously injured or killed. I have trouble having, I am troubled by having acted in ways that violated my own morals or values, and so forth. It's virtually the same symptoms, except they're modified to some degree in order to apply specifically to civilians rather than to military members. Okay, here's the moral injury symptom scale healthcare professionals version. So this is the one that has, this has been published, I forget where it's published. I think it's the Journal of Religion and Health or the Journal of Nervous and Mental Disorders. One of those journals have published this. And here are examples, again, just slightly modified from the military version. I feel betrayed by other health professionals whom I once trusted. I feel guilt over failing to save someone from being seriously injured or dying. I feel ashamed about what I've done or not done when providing care to my patients. I'm troubled by having acted in ways that violated my own morals or values, and et cetera, including I sometimes feel God is punishing me for what I've done or not done while caring for patients. So in any case, those are the versions. And again, I'm happy to send you a copy of these scale, the one or more of these scales if you want. My email address is harold.koenig@duke.edu. So now many people have questioned whether or not moral injury and PTSD might be the same thing. And we don't feel that that is the case. We feel that moral injury and PTSD are two separate syndromes, but they do have some overlap. So let's look at this visually. So moral injury involves moral concerns, betrayal, loss of trust, difficulty forgiving, loss of meaning, self-condemnation, religious struggles, and loss of religious faith, as we've seen in the scales. Now, the guilt and shame tends to overlap with DSM-5 PTSD criteria, but those are the only dimensions of moral injury that appear to overlap. And that would be in criterion D of PTSD, which is negative alterations in cognitions or mood. So distorted blame of self or others causing guilt and shame. So there is some overlap, but clearly moral injury is different from these other symptoms of intrusion, of avoidance, of alterations and reactivity. So these are two separate syndromes. And in fact, there's some evidence that even when you look at parts of the brain that are involved in these syndromes, that they're different. So let's look at that. Let's look at the neuroanatomy of moral injury in comparison to PTSD. So in PTSD, you have an overactive amygdala, which is in charge with interactive with an underactive prefrontal cortex that dampens down this stress, this aggression center called the amygdala. So what happens is that you have fight or flight responses that occur in non-dangerous trigger situations. So when the person with PTSD gets in non-dangerous situations that trigger this reaction, they will have PTSD symptoms, even while not actually in the trauma where it originally occurred. All of this trauma, this stress gets stored in the brain. Now, for moral injury, rather than an underactive prefrontal cortex, the prefrontal cortex, in fact, must be intact. And in fact, it may, in some respects, be functioning really well. This is where moral thinking is located. It's the prefrontal cortex, that part of the brain, cerebral cortex, that makes us uniquely human. So again, the idea is that PTSD is occurring in a different part of the brain than moral injury, and it involves different either underactivation for PTSD or overactivation, or at least appropriate activation in moral injury. Now, what's interesting is in patients who have a certain type of dementia called frontotemporal dementia, that what happens is that the frontal cortex, that prefrontal cortex, is affected by the frontotemporal dementia, and the symptoms involve a loss of moral behavior. So these individuals are disinhibited. They do things that most normal people will not do. They can't suppress their sexual urges. They may touch someone that they don't know sexually, or they may say things that hurt other people. They lose this sense of being able to feel for other people and what they're going through. So this and that is due to the damage in the prefrontal cortex. Okay, so in any case, there are biological roots to this syndrome of moral injury, and those are different from those biological roots of PTSD. So what are some interventions for moral injury? Well, first of all, there are some secular psychological interventions that have been developed, and these include adaptive disclosure therapy. And these are for psychologists, primarily licensed professional psychologists or counselors. And this is a treatment that Brett Litz developed. He is the fellow the definition of moral injury in 2009. He was the person that I began this lecture quoting on the definition of moral. He's developed this adaptive disclosure therapy. There is also a treatment called the impact of killing, and it addresses, the symptoms of guilt and shame that people experience who have killed others, as in war. And then there is acceptance and commitment therapy, which has been developed to address some of the symptoms of moral injury. Again, mostly the psychological symptoms. Now, there are also some spiritual interventions, which include building spiritual strengths. This is an intervention developed at the Veterans Administration Hospital in Minneapolis by Dr. Virginia Harris. Dr. Harris, she developed this intervention that can be administered as a group. Typically, it's used as a group intervention, and it can be used for the treatment of both PTSD and moral injury. We've developed 2 different interventions that address the 10 symptoms of moral injury. For psychologists and counselors, we've developed spiritually integrated cognitive processing therapy, SICPT. So cognitive processing therapy is the primary treatment used to treat PTSD, at least in the United States and in the Army, and also in the VA, the Veterans Administration Hospital, cognitive processing therapy. So we've altered cognitive processing therapy, the treatment, so as to target the symptoms of moral injury, not PTSD. And so I'll show you this therapy in a moment. And then we've also developed a chaplain or clergy intervention or counselor intervention that involves pastoral care and is religion specific. And I'll show you that also in a moment here. So here is the spiritually integrated CPT. The SICPT, again, this is for psychologists, counselors, people who are licensed. And so it's manual-based, structured psychotherapeutic intervention for moral injury in those experiencing severe trauma. So it's a manual, we have a manual for it, and it's a structured psychotherapeutic intervention that can be used. And also we have workbooks for patients to use to do their homework on. It's 12 sessions. It's an individual in-person treatment that's typically delivered over 6 to 12 weeks, typically over 6 weeks at 2 sessions per week. And again, these are addressing the symptoms of moral injury. SICPT is a spiritual, religiously integrated intervention using a CPT framework. Okay, so we use the CPT, the cognitive processing therapy framework, and and then altered it so that it includes spiritual principles to address these symptoms of moral injury. The idea is that by reducing moral injury, the goal is to decrease trauma symptoms and other comorbid conditions that occur with the trauma symptoms, such as depression, anxiety, substance abuse, relationship problems, etc. Now, we've developed a general spiritual version of CPT, but also we have religion-specific versions of SICPT that are in the Christian tradition, the Jewish tradition, the Muslim tradition, Hindu and Buddhist tradition. So for the 5 major world religions, we have the SICPT that is specific to that patient's religion. And we think that is really important to make it specific to the person's religion. And if you're wanting to know more about the spiritually integrated SICPT, here's an article that is available at the bottom of this slide here. It's available for free, free download at this website address. This was an article published in Global Advances in Health and Medicine. And in fact, here are the 12 sessions, just to give you a sense of what this intervention is like. Again, this is the broadly spiritual version of the intervention. It is not religion specific, but it does focus on more the monotheistic belief system, that that spiritual version, monotheism. So first of all, in the initial session, the therapist introduces the rationale for SICPT, and then describes the goals of the treatment, and then patients are given a practice assignment. They're asked to write the initial impact statement that focuses on the moral injury itself, on how it's impacted their conscience, their relationship with God, with others, and the world around them. In the second session, the patient reads their impact statement and begins to work on points where they have gotten stuck in terms of their recovery from the moral injury. People get stuck in various places. They can't get beyond, this point of being guilty or ashamed, or not trusting others, or not being able to forgive others. They get stuck there, and they're there, for weeks and months and many times years. And this treatment helps them to get unstuck so they can move on with their lives. And the other sessions start to focus on kind attention and compassion to oneself, and then go on to address spiritual distress and grief. And then in the 5th session, spiritually oriented, challenging questions, based on the current person's maladaptive assumptions and exaggerated feelings or thoughts. It follows a very cognitive behavioral model of treatment. And oops, here. Yeah, and so then we go on to look at divine forgiveness, and then look at, we really get into for a lot of forgiveness intervention in this, because inability to forgive is such a prominent feature of moral injury. And so we have 2 sessions on that. And then making amends, doing things to make up for the perceived transgression. So we march through this. Issues with intimacy are also addressed, developing spiritual partnerships, particularly in one's religious congregation, and then dealing with post-traumatic growth, and then again, identifying any remaining stuck points, and then paying it forward to others, family, spiritual community, and those in need. In other words, doing penance in order to make up for the perceived transgression. And this is really establishing a lifetime of behavioral change to completely heal for these transgressions that have been committed. So this treatment puts the person on a pathway to recovery. Then we also have a manualized, structured 12-session pastoral care intervention for moral injury that clergy, that chaplains, that counselors, or people who are not licensed to practice, they can use this intervention. And it's for the Christian version, it's heavily Bible-based. And for the Jewish version, again, this is in 5 different religions. Jewish version is based on the Torah and Talmud, the Muslim version on the Quran, the Buddhist version on the Dhammapada, and the Hindu version based on the Bhagavad Gita. So these are 12 weekly sessions, 50 minutes long, targeting each of the 10 dimensions of moral injury. So here are the 10 dimensions of moral injury. Again, I described these earlier. They follow right along our 10-item moral injury symptom scale. And so the way it works is that there is a session on each of these 10 symptoms, particularly those symptoms that are causing a lot of distress to the individual. Okay, so now if the symptom is not particularly prominent, if they're not having a lot of betrayal feelings, then that can be combined, this and another symptom of moral injury can be combined in a single session. And in fact, some sessions, such as difficulty forgiving, may require 2 sessions, 2 separate sessions to address it. Now, here are the treatment modules that are used to address each of the moral injury symptom dimensions. So there is first, and this is in order, the order in which these treatment modules are administered. First of all, there is a focus on conviction, the idea that a person has transgressed their moral code and they're feeling bad about having done so. And then lamentation, actually lamenting over having done so. Now, most of the time when people come in for help, they've already been dealing with conviction and lamentation, and that has given rise to the moral injury symptoms. So what the therapist or the clergy person does is they begin with this module on repentance. So the repentance, it has the person express, that they've done something wrong and confessing it. And then there is the receiving and the giving of forgiveness, and then reconciliation with God, and then atonement, doing some kind of penance. You can see that many of these modules follow the SICPT model that we developed for a licensed clinician. And basically, these are the things that need to occur before somebody can get completely healed of their moral injury. And religious institutions have known this for thousands of years, and this is how many of these religions in the past dealt with sin and dealt with moral injuries of various kinds. Now, if the person is angry, then we have an optional model to address the anger, because if anger is present, then you can't really get through this because anger will block the progress. So that has to be taken care of first. And then you can go through the confession, forgiveness, reconciliation, and atonement. And again, both the SICPT intervention for psychologists and licensed practitioners and this pastoral care version of the SICPT, both of these treatments only set the person on a pathway that eventually leads to recovery if they will continue to practice forgiveness. They build up their relationship with God, and they atone for their moral transgressions in terms of investing into the lives of other people to make up for those transgressions. And, actually, the atonement, the things that we are advocating here, people ought to do that anyway, because in many respects, we all have moral injury symptoms from transgressing moral values. I mean, indeed, all have sinned, right? And so to some degree, we should be atoning for these sins by investing in the lives of other people and making life better for others. That's just the way to live a happy and fulfilled life, is to live a life of service to others. Now, we've actually completed doing this chaplain 12-session intervention with veterans who experience PTSD. And what we found was that the actual PTSD symptoms drop dramatically when we do this moral injury intervention. When the chaplain, and this is the 12-session chaplain intervention that I've been talking about here, using these modules. So over the 12 sessions, you can see that even though moral injury symptoms, this is the line for the moral injury symptom scale, drop only a slight amount from baseline, look at what happens to PTSD. It drops in more than half those symptoms. So this actually suggests that moral injury is serving as a barrier to the recovery from PTSD in these situations. So that's the first patient, and the effect was replicated in the second patient that we used. Again, this is a chaplain intervening on a patient with significant PTSD and moral injury. And again, you see a relatively small drop in the moral injury symptoms, but a dramatic drop in PTSD. So basically, if you remove the moral injury, PTSD will respond much better to treatment. So in summary, moral injury is a relatively new syndrome that is distinct from PTSD, that often occurs in those suffering from various forms of trauma, where there is a perceived transgression of moral values by either oneself or by others. There are numerous measures of moral injury that can be used to identify it. There are both the combined events and symptom measures that could be used for screening, and the pure symptom measures that can be used for both identifying moral injury and tracking the symptoms over time in response to the interventions that I've been talking about. The symptoms of moral injury are psychological, spiritual, and religious, all of which must be addressed for complete healing. There are secular, spiritual, and religion-specific treatments for moral injury, and there is preliminary evidence that these treatments actually work. And there are versions of religion-specific treatments that are available for Christians, Jewish, Muslim, Hindu, and Buddhist faith traditions. Okay, so here are some further resources. I wrote this little book here called You Are My Beloved, Really? And it's available on Amazon. We actually have proposed to use this book in our treatment of moral injury, whether that be SICPT or whether that be the chaplain intervention. A lot of these individuals simply don't feel loved by God. And so this little book is designed to discuss that and help people experience that love of God that will help to heal their moral injury. Then there is a book called Religion and Recovery from PTSD that I mentioned earlier. And that looks at the role that religious faith has served over the centuries, over the millennia, in terms of helping people to recovery from PTSD, because many of the major religions involved war. And so when the warriors came back from battle, there were these various rituals that were religious in nature that helped them to reintegrate back into the community. And so this book discusses that and includes sections on moral injury as well. Then there is our pastoral care for moral injury that I've been talking about. You could send me an email. I'm happy to send you our structured pastoral care manual, along with a clergy workbook and a patient workbook. And then the spiritually integrated cognitive processing therapy, the manual, the therapist workbook, and the patient workbook can all be obtained from Michelle Pierce at the University of Maryland, who helped who actually developed the intervention. Her and I developed it. And so if any of you are interested in doing research in this area, come to our research workshop. It's this August. It's 5 days here at Duke University. We deal with a lot of issues. We have an amazing faculty that teach it. So if you're interested, you can send me an email as well, and I could point you to our website. And if you can't come to our workshop, then I would encourage you to get the book Spirituality and Health Research, which will help to train you to do research in this area. And it's basically a summary of the 5-day workshop. And then here's our website. The website has changed some because it's been transformed to a different platform, but this website address will get you there. And it's got, again, you can download the various manuals. It's got a lot of information, including recordings of our monthly seminars that you can watch, and also you can then sign up for our e-newsletter and then participate in our monthly Zoom seminars as well. So there's a lot that you can get out of this website. So thank you very much for listening to me in this presentation.